Well, thank you, Mr. Chairman. Dr. Fauci and Dr. Redfield, I'm a scientist as you are, and so you know how important it is that when a great scientific breakthrough reaches the public, that the proper credit is given, not to just those who show up and claim credit at press conferences, but to the long list of federally funded researchers who've made these breakthroughs possible. And also to the enlightened federal employees and the politicians who funded that research. I remember back when, a few years ago, when we had newspaper headlines about all the miraculous cures in cancer immunotherapy, where I gave a floor speech in the U.S. House saying, yeah, this was great, but equally great were the decades of federally funded research and the researchers who made those clinical breakthroughs possible. And also, frankly, that some of the credit goes to the Democratic and Republican members of Congress who resisted the proposals for massive budget cuts to science that were proposed by Republicans for years in the Paul Ryan budgets and by the Trump and Mulvaney budget cuts since then. Now, in the case of the mRNA vaccines that have been so much in the news this week, the story does not start with Operation Warp Speed. It does not even start with a historic 63-day sprint from the publication of the viral genome to the first patient injected by the mRNA test vaccines. The sprint, I believe, began when President Trump, well, this sprint actually began when President Trump was still ridiculing the idea of the pandemic. The sprint actually started when dedicated employees at NIH and Moderna who understood the danger of COVID-19 and began working day and night. The story of federal investments in mRNA vaccines actually starts, I believe, back in 2009, when President Obama, who was at the time unhappy with the speed of response to the H1N1 swine flu epidemic, convened his scientific advisory panel, PCAST, which they did back in those days, and famously asked them, if you guys are so smart, how come you still make vaccines with chicken eggs? Okay, so 1 year later, in August 2010, PCAST put out a report on re-engineering vaccine production for pandemics, which emphasized the potential of new technologies to make vaccines and therapeutics available far faster in a pandemic. Heeding the advice of his scientific panel, which they did back in those days, in 2013, the Obama administration awarded a $25 million DARPA grant to a startup called Moderna to develop their mRNA vaccine platform for pandemic response. This was followed in 2015 by a $125 million investment by BARDA, so that by the end of the Obama administration, Moderna had mRNA vaccines and therapeutics under test in both animals and humans. So why is it that the Obama administration prioritized mRNA vaccines and therapeutics? Well, first off, it's their speed of development, which we saw realized in the 63-day sprint. It's the speed of manufacture, which has to do with the high yields of in vitro transcription reactions, and their potency. Scientifically, the exciting news of the last few months is that a potent human immune response can come from doses as low as 30 micrograms of mRNA vaccine. So 30 micrograms, what does that mean? What it means is that this 1 liter bottle, if it were full of mRNA vaccine, would contain over 30 million doses. This is enough to vaccinate every one of Americans' doctors and first responders, or all of its seniors over 75 years old. And that is why the Obama administration invested in mRNA vaccines and therapeutics starting back in 2009. And without those investments, frankly, Project Warp Speed would not have squat. Now, Dr. Fauci, would you agree that when there are great medical breakthroughs, that the public needs to be reminded about the long line of federal R&D that's led to vaccine and therapeutic successes that we're anticipating?
Yes, Congressman, and it even goes beyond what you're saying. Everything you say is very well taken. And I think maybe it's a good time to recognize the fact that the generosity of the Congress through multiple administrations, both Democratic and Republican, and whether or not the Congress was controlled by Democrats or Republican, the support for biomedical research that goes back decades, leading to everything that you're talking about, but even before then, some of the monoclonal antibody work, some of the work that's being done with the molecules that are directly antiviral molecules. I think we often forget that when we think of the product and often forget, as I think you've appropriately pointed out.
Well, what
a
are the
lot of
scientific
important things.
investments we should be making now to ensure that we're better prepared for future pandemics? And how can we support those investments with the kind of science budget cuts that we're seeing proposed in the Trump and Mulvaney budgets?
Well, I mean, I hope we don't get cuts, but in fact, we have been very
But they've been
generous.
proposed. They've been proposed again and again. Okay.
Yeah.
Anyway, it looks like my time is up.
Mr.